physician orders a prothrombin, PTINR, a complete blood count, and a blood type test. Which of the following represents the correct order of draw? So I cannot emphasize enough that you do need to know the order of draw for any exam, your certification exam, and I'm very sure for your class, okay? So a couple ways you can go, and approach this question. So we do have the actual test. So you can go ahead and translate that to the tube that it's going to be used and then put it in order of draw. So here, your PTINR is your light blue. Your complete blood count is a lavender. And your blood type testing, that one, it's not very specific, but usually that one is also done on EDTA or lavender. But if it's just like chemistry testing, then that would be a red top testing, okay? So definitely know your order of draw. Hello, how's it going? I'm so glad you're joining the review. Always keep studying, keep practicing, yeah. And if you have any questions, go ahead and put them in the comments so I can make sure we have a comprehensive understanding, okay? So here we have our tube colors. So if we go in the order of draw, we know it's blood cultures, light blue, red, yellow, green, lavender, and then gray. So looking at what we have here, we have light blue, we have our red, and then we also have our lavender. Okay, so here we're going to go ahead and our answer is D. So it's in that order. Now be very careful. Some questions on your certification test may be order of draw, but they may ask for a specific tube number. So for example, maybe this question said, which of the following represents the correct order of draw? Or it would say, which tube would you collect second, right? Or which tube will you collect last? Your question may be worded that way. So if that's the case, go ahead and put your test in the order of draw and then answer the question. Oh, this one you would do second, this one you will do last. Here it just wants order of draw, so it will be light blue, red, and then lavender. It would also be a good idea to know what tests go in what tubes. And just to kind of go over that real quick here, blood culture is blood culture, so that goes first. Your light blue are your coagulation test. So if there's anything for coagulation, that's your PT, INR, APTT, bleeding time, that's going to be a light blue top. Your red top or yellow, also known as your speckle top or tiger top, this is all chemistry testing, okay? After that, you have your green, which is heparin. This is going to be tests like ammonia or stat chemistry. Your lavender is all hematological testing, so your CBC, your A1C, platelet count, differentials are going to be that. And lastly, gray is your glucose tolerance test or your lactic acid. Those would be some tests to kind of get familiar with and know, so if you get asked the test and then what tube order of draw you put them in, you're going to be more aware, okay? Hello, hello. Oh, I'm so glad you're joining the live, yeah. Okay. Is there an easier way to remember the order of draw? So one way that I've studied is I put it in note cards with the color note card, and okay, like light blue are these tests, red are these tests, green are these tests with the additive, and it's just that kind of that repetition. I'm sure there's some mnemonics out there to kind of help, but just going over it like on the note card and putting the note cards in the correct order of draw is what helped me learn both the order of draw and what tests belong in that tube. Okay? It's just some things it's just repetition, like order of draw. Okay, so your answer again will be D. And notice how all the answers have the same kind of colors. If you want to do process of elimination and you know your order of draw, you could already eliminate some answers, like you would never collect light blue last, that's always a first tube. And then, because we know light blue is one of the first tubes we collect, you can kind of already remove some answers as a possibility and then you would just be stuck here. So lavender, being EDTA, is usually collected last unless there's a glucose test. So that would lead you to answer D as well. Okay? Awesome, let's go to the second one. And again, if you have questions, please feel free to put in the comments. I want to make sure everyone has a good comprehensive understanding. Some questions will be easier, some questions will be harder. It's all about review and practice and having some fun. All right, so this is a pharmacology question. So this is, a patient is prescribed 500 milligrams of amoxicillin. The available stock is 250 milligrams per 5 milliliters. How many milliliters should be administered? So already we know what answer our unit is in. Be very careful to read your units. I have seen some tests, well, it'll say 5 ml and then another option that says 5 mg, and it's there to throw you off. So make sure that you are reading your units, because you don't want to quickly pick an answer and it had the wrong units. Okay, so we're looking in milliliters. So our dosage formula is doctor's orders over on hand times the vehicle. There is no word here that's saying this is a pediatric patient, so we're not thinking pediatric formulas. Pediatric patients will either tell you their age or their weight, or it'll say pediatric patient. So just keep that in mind when you're going through some problems with dosage, if it's pediatric or not. Okay? So doctor wants that 500 milligrams. You have 250 milligrams per 5 milliliters. So pretty straightforward. You have milligrams over milligrams, that cancels out. If you had 1 in grams, you would have to convert. That will put you at 2 times 5 ml. And you get, of course, I saw it in the answers there, you get 10 ml. So that would be C. So good job. I saw some answers in the comments. Great job, guys. Okay, so that would be how you solve for this answer here. So doctor's orders, they want 500, available on stock is 250, and then per 5 ml is our vehicle. Awesome. All right, you guys are doing awesome. Let's go to the next question. All right, when performing a 12-lead EKG, V4 lead is placed at, so yes, do know where your leads are placed, the anatomical description, okay? Now, remember that your V leads, so anything that starts with a V, you have V1 through V6, are also known as your precordial leads, okay? So precordial leads means it's around the heart, okay? So we're thinking about what's on the chest, not the limb leads. So first things first, we know that. Second, they're either going to be in the 4th or 5th spaces, so in between the ribs. V1 and V2 are the only ones on the 4th intercostal space. The rest, except for V3, so V4 to V6, are on the 5th. So automatically, we can get rid of these two answers. Now we're stuck between these two. V4, since they're in numerical order, it's not going to be between 2 and 4, making our answer B, 5th intercostal space. If you're not sure what this means, midclavicular line, it means if you find your clavicle, that's your collarbone, and you find the midway of it, and then you go down 5 spaces between the ribs, that is where your V4 should be, and that actually lines up. So that is going to be your answer. So again, do some process of elimination here, but do review the sites of where you put your V's, okay? V1, V2, 4th place, either left or right side of the sternal border. V3 is between V2 and V4, that one's easy. And then 4, 5, and 6 are on 5th space, midclavicular line, anterior axillary line, and then mid-axillary line. So in that order, okay? All right, I don't see any questions in the chat. I do see some correct answers, so awesome job. Let's go to our next question. Okay. Which of the following is considered a violation of HIPAA? So do be aware of some federal laws, so like HIPAA, the Good Samaritan law, privacy notices, and what's OSHA, you know, kind of what OSHA is, and high tech, and the Self-Determining Act. I would be familiar with kind of what those acts are. So then when you see it in a question, you're like, oh, I know what that is. So just make sure you know those federal regulations. Okay, so in HIPAA, that stands for the Health Information, Privacy, Accountability, Portability and Accountability and Portability Act, right? So it's keeping information safe in the office, but also how we share information too. So here, as we're looking through our answers, there's going to be one that's going to violate it, one that's going to be against keeping patient privacy, right? And that is going to be, if you haven't read the answers yet, it's going to be A, informing a patient's spouse about their test results without the patient's consent. So there we go. We see consent. We see permission. We told their spouse about results without the patient's consent. That is violating HIPAA policy. Now, it doesn't matter if it's their brother, their sister, their daughter, their spouse. If there is no consent, we cannot share that information, even if they live at the same address, okay? Patients charged for billing purposes, it doesn't violate it because at the beginning of a visit, when they do the privacy and notices and they give us assignment of benefits, they're allowing us to share their information with insurance for reimbursement. Cases of child abuse, that's again another legal thing. Like we have to report, it's part of also like how they measure like deaths and births and abuse and that statistics. So we do have to report that. And then discussing a patient's case with a consulting physician, this is continuity of care. So if I'm referring someone to another specialty, we have to share just the need-know information, okay? But again, no consent, no HIPAA. Good job, guys. I see the answers in the chat. Awesome. Okay, so now we have the S in SOAP stands for. And if you haven't heard of SOAP before, it's not a hygiene thing. It's a way that we document inside of the chart, especially when we talk about problem-oriented medical record, known as the POMR. That stands for problem-oriented medical record. This is when we, have certain issues like diabetes, high blood pressure, and then we have our SOAP notes in that. So the S in SOAP is actually going to stand for, I see it in the chat, the subjective. So when we talk about subjective, the subject is the patient, all right? Subject is the patient. So whatever history, symptoms that the patient tells you, that's subjective. So from their point of view. So if you have a question that says, patient comes in, they tell you that they've had a headache for the last 3 days, what part of the SOAP note does this belong to? Guess what? The patient told you. The subject told you. That is a subjective, the S in SOAP. If the question said, you're entering vital signs, what part of SOAP does that go into? That's going to be the O for objective. Objective is everything you see and you document. So your vital signs, you did that, right? You notice visible like scarring or, rashes or something. That's also an objective sign too. And then just to be thorough with the question, A is for assessment. So that's going to be what the doctor, diagnoses the patient with. And then P is the plan. So what's the plan of care? Okay? All right, I'm just going to check to make sure I don't miss any questions. All right, nice job. I'm seeing some answers there. Good job. Yep, that's right. You're going to do the assessment and the plan, but that's usually done by the physician because we as medical assistants cannot diagnose and create a plan of care, right? We have to be licensed, and for that, we are not. We're just certified. All right, next question. Good job. Everyone's doing awesome. Again, if you have questions, please feel free to put it in the chat just to make sure we're thorough with our questions and you have an understanding of that topic. All right. So, which of the following is the most appropriate position for a patient experiencing syncope? Syncope is also known as fainting, okay? The exam, the national exams, may not tell you what the medical term means. So it may just say like that. So make sure you know these medical terms: syncope, nosebleeds, epistaxis, things like that, okay? All right, so if my patient is fainting, right, what position do I want them in? So the best position is going to be also known as Trendelenburg, but it's going to be supine with the legs elevated. This is also known as a shock position. You may also see it as Trendelenburg. I might check the spelling on that. Trendelenburg. It means the distal appendages, so the legs, are going to be higher than the heart. And that's to kind of help bring blood flow back to the heart and brain, so then those are vital organs and they stay working. Fowler's position, that's pretty much kind of sitting like 90 degrees, legs sticking out. It doesn't really help with fainting. Sims position is for like colonoscopy procedures, not very helpful with fainting. And prone is belly down. Again, not the most comfortable position for fainting. We want to help them, keep their vitals up. So supine, which is on their back, legs elevated, also known as Trendelenburg, is going to be the best position if someone is fainting. Okay? Awesome job. All right, let's go to our next question. Like I said, I only have about 25 questions here, and then we'll do open discussion. So if you have a question about anything, you can ask, and then we'll go over that, okay? All right, a CLIA wave test requires the medical assistant to... So be familiar with CLIA. All right, that's the Clinical Laboratory Improvement Act, I believe of like 1986, 1987. It's been out for a while now. This are the tests you're allowed to perform as a medical assistant under provider's licensure, okay? They have to be CLIA wave tests. If they're not CLIA wave tests, we cannot perform it as medical assistants. They're usually low error, which means as long as we perform the test, like the manufacturer told us on the box, we should get an accurate result, okay? So, again, knowing that information, we must follow the manufacturer's instructions exactly, okay? If we start doing our own thing, we cannot attest that this will be accurate, okay? We don't have to be specialized in lab science. It's not the process of sending a reference specimen, and it's not microscopic analysis. So follow the manufacturer's instruction exactly. That's what CLIA wants us to do. All right, let's go to our next question here. The term nephrothilasis refers to which condition? So be familiar with your medical terms, because that's going to help you on your exams. All right, so here, sorry about that, guys. All right, so first, nephro means kidney. All right, and so does reno. Reno also means kidney. If you ever see lith, that means stone. And then asis is condition. So we can go ahead and circle A, condition of the kidney stones. And even if you didn't know what the rest meant, you just knew kidney, then that's going to be a quick process of elimination, because that's the only one that contains kidney. Okay? All right. Let's go to our next question here. This is a phlebotomy question. So it's good to know the procedure of phlebotomy and the purpose of the equipment in phlebotomy. Those are some questions that may be asked on your certification exams, okay? So what is the primary purpose of using a tourniquet during blood pressure? We know that's that elastic band that goes around 3-4 inches above where you're going to draw blood. The whole purpose of it, and I hope your instructor explained it to you, is that it helps your veins pop. Okay, that's the whole purpose of it. It acts like a little stoplight, all those red blood cells, having traffic there, so the veins bulge out, making it easier to palpate. Palpate is a process of, using your 2 fingers to feel for a structure. All right, it's not to sterilize. It doesn't prevent them from moving their arm, and if you worked in pediatrics, you know that. And it also doesn't increase arterial blood pressure. That has to do more with the arteries and like their ability to stretch and come back. We don't draw blood from arteries, right? Venipuncture, veni literally means vein. So nothing to do with that. So to make the veins more prominent and easier to palpate is the best answer here, okay? And just remember, some certification questions, you may have 2 answers that are good and correct. Always go with the better answer, the one that's like really encapsulating that question, okay? All right, let's go to the next one. You guys are doing amazing. So, which of the following is an example of a parenteral route of medication administration? All right, so this is going to be your keyword here. Whenever you see this word, remember, parental means avoids enteric route. Enteric, enter means gastric, intestine. So it's not going to be digested and then go through the bloodstream through digestive processes, okay? This is going to be something else. So now that we know what parenteral means and we know like, okay, it's avoiding the GI tract, we can use process of elimination here, right? So for example, oral tablet, you have to, administer that through the mouth, so nope. Sublingual film, that's also in the mouth. You're getting rid of that. And now we have these two options here. So topical, it's already in the name, that's a topical medication. It's absorbed through the skin. Parenteral is going to be more of injection. So whenever you see parenteral, my thing and what I tell my students is think of injections. That's usually what they're looking for. Okay? Awesome. I see some answers in the chat. Good job, guys. Okay. Let's go on to the next question. And remember, if you have any questions about a certain thing we're covering, just put it in the chat. Okay. This is a blood pressure question, vital signs. A patient's blood pressure is 150 over 95 mmHg. That's just the unit of blood pressure measurement. What is this classified as? Okay, so when you're reviewing your vital signs, make sure you know your normal and abnormal ranges. Okay? All right, so we know, let's write down what we know. So we know normal is less than 120 over 80. Clearly, that's not it, so we're going to eliminate that. Okay. If someone's elevated, all right, they're not in the stages yet, they're just a little higher, that's your 120 over 130. Clearly, that's not the number we're looking for, so we can go ahead and remove that. After they passed the elevated stage, after they passed the elevated stage, now we're getting into the true hypertensive stages. So 130 over 140, usually 80, 90, that's going to be stage 1, which again is not what we're looking for here. We're looking for 150 over 95. So through process of elimination, that's going to be hypertension stage 2, which we know is going to be that 140 over 150, and then usually 90 or higher, okay? They do follow the American Heart Association classification chart, so if you are not familiar with it, go ahead and Google just AHA, blood pressure guideline, and it'll give you a really, really pretty chart of these stages. Stage 1, stage 2, stage 3, and hypertensive crisis, which is usually 180 and above, okay? All right, so that means this is stage 2. Perfect. All right, I don't see any questions in the chat. I see a couple of answers there. Good job. Okay. All right. Our next question here. The process of completely destroying all microorganisms, including spores, is called. Now, when something says including, I would pay closely attention. Spores. Destroying all microorganisms and spores. And there's only one that's going to do that. And that's going to be your sterilization. Okay, this is part of infection control. Know your order of cleanliness. Sanitization, disinfection, sterilization. That's the order of cleanliness. So always think about like the levels of us killing certain microorganisms. Sanitization, that's your hand washing, that's your alcohol hand rubs. Disinfection, that's using Clorox, that's using stronger detergents. And then sterilization is using things like an autoclave or heat sterilization to completely get rid of everything on an instrument or an object that can fit in the autoclave. Since we're destroying everything here, that is sterilization. That's what we're looking for. If it said something about surgical procedures or surgical asepsis, you're looking for sterilization. Okay, so there's some keywords that you know. Surgery, surgical asepsis, I'm looking for sterilization. Antisepsis is just an umbrella term that means to be free of microorganisms or pathogens, but not necessarily spores. And the only thing that kills spores is sterilization. All right, good job. Let's go to the next one. This is now an administrative question relating to coding. In the context of medical coding, what is the primary purpose of ICD-10-CM? All right, so in ICD-10, I think it's International Classification of Diseases. This is the code that physicians and providers use for diagnoses, right? A diagnosis is essentially something that the physician or provider tells you that you have going on or that they suspect. So it's a disease, it's a diagnosis. So the only one here that is talking anything about a disease or diagnosis is going to be C. Medical procedures and services, that's going to be your CPT codes. Identifying pharmaceutical products, that could be the physician desk reference, also known as a PDR. And bill for durable medical equipment, that's just a bill. That's really nothing. It could be part of Medicare Part B, because that's where the DMEs are usually done. Okay? But ICD-10, diseases. All right, I see that. I see your guys' answer there. Awesome. All right, let's head to the next question. Okay. Oh, now we're talking about some legal stuff here. A patient provides implied consent when they, so go over your medical law and ethics, especially consent, implied consent, informed consent, expressed consent. Know the differences between those three. So implied consent means that the patient has already signed off at their first patient visit that they are allowing the office to provide them services, okay? That's why you can bring them back and usually do their vital signs. But you always want to make sure and get express consent, like that yes or no. But implied consent, you're using body language pretty much to know that you're allowed to do that procedure. Again, has to be within your scope and everything. So in this example, under implied, we're looking for they're extending their arm for a venipuncture. So if they're extending their arm for like a venipuncture or even like a blood pressure, you know, if you have to swab the throat and you know they're already kind of tilting their head up, those are all signs of implied consent. Okay? Detailed consent form before surgery, that is your informed consent, especially it needs a signature. Verbal agreement to a treatment plan, that's expressed consent. But also because it's a treatment plan, it usually falls under informed consent as well. Are unconscious and require medical treatment, this one is falls under the scope of the physician for sure, unless you're under the Good Samaritan Act where you like need CPR or like, you know, and you're trained and you can provide it. But that's not really implied consent. They follow that under express consent or something like that. But it also depends on the state. So we want to be clear of which one's true implied consent, and that's going to be the patient giving you their arm after you've informed them that, you know, you're going to do a venipuncture. Okay? So know the difference between informed and implied and express. That's going to be really important for some of these questions, okay? All right, next question here. You guys are doing awesome. I'm seeing some answers in the comment. And again, if you have questions, just put it in the chat. Which of the following describes the function of the sinoatrial node, also known as the SA node? This is electrocardiogram, and they love to ask electrocardiogram questions. The placement of the leads, the purpose of it, artifacts, the conduction system. So make sure you review that information. Depending on which exam you sit for, sometimes an EKG can be like 5 questions up to 10 questions. Just depends on which test, but they do like to ask about it. So in our heart, I'm going to draw a little heart here. We have the SA node, the AV node, the HIS, and Purkinje fibers. I misspelled that. Purkinje fibers. Essay node is the first, and if you don't know what the essay node is, it's pretty much the nervous system telling the heart when to contract. Essay node is first, and because it's first, it's acting like the pacemaker of the heart. So keep that to memory. SA node is the pacemaker of the heart. Okay, everything else is either, this is AV node, this is the bundle of His, and this is the Purkinje fibers. Okay, so maybe on your test you get a question that says, which of the following describes the function of the AV node? Now you know it's this. Or what's the function of the Purkinje fibers? Now you know it's this. So don't just know SA is pacemaker. Also know what the other nodes or nerve fibers in the conduction system do. All right, let me make sure I'm not missing anyone's questions here. Okay, I don't. Thank you so much for the likes and follows. I appreciate it. And again, if you have a question, just put it in the chat there. All right, next question. According to the rights of medication administration, which of the following is not one of the core rights? When you read your questions, make sure you read for anything that says not, except, best, first, last. Some of my students get excited, they read the question, they missed the not, and then they circle the answer that they see, and then they don't know why they got it wrong, okay? Watch out for these buzzwords, right? Not, except, first, last, best, because that can save you from, losing easy points, okay? So in the rights of medication, depending on which textbook you're reading, there's 6 rights. Some of them have 7 rights, but one of these is not like the other, and that is the right diagnoses, okay? They have it in there because you're thinking, oh, well, the patient has to have a diagnosis in order to get this medication. Yeah, but the whole purpose of the rights of medication is to make sure that you, as a medical assistant who is trained, gives the correct script as it was done per the provider, right? So 500 of amoxicillin and, oral or tablet or suspension, you make sure that you're following, triple checking that you are giving that medication correctly. So you do check the right dose. How much am I giving them? Did I do my math problem correct? You are checking the right patient. Am I giving it to the right person? And of course, you want the right medication. I think that's going to be the most important. Yes, that's correct. It's to prevent medical errors. Okay, medication administration errors. So you got to check that. Some things that are missing is the right time, the right route, the right drug form, the right documentation. Yeah, I think those were the last ones. Yep. Okay. Awesome. Let's go ahead and go to the next question. You guys are doing amazing. We still have a few more here before I open up the floor for any open questions. So, when instructing a patient on how to collect a 24-hour urine specimen, the medical assistant should tell the patient to 24-hour urine specimens are, I used to do that forever when I worked in oncology. They have a very specific direction. Okay. If you haven't gone over a 24-hour urine collection, here's some things you need to know. First, yes, they need to collect it for a full 24 hours. And it can only be urine collection. If the urine specimen gets mixed with anything else, they have to start over. So the patient is just collecting their urine as normal. They don't change their diet. They don't change the activities. We want to see what the kidneys are excreting in a day's period. So drinking excessive amounts, not correct, okay? Collect the start at any time and record the start time. No, we want a start and end time that's a little bit more specific, okay? So for a 24-hour urine, the patient's going to wake up. They're going to urinate void as normal. So it's going to go into the toilet, hopefully, into a toilet. After that, they're going to collect for a full 24 hours, including the urine of the following morning, right? So the first urine of the morning they skip, But then to complete the 24 hours, the first urine of the next day they're going to collect. So that's going to fulfill their 24 hours. Okay? So that's going to be your A. Discard the first morning void and then collect all subsequent voids for the next 24 hours. And notice how this one says collect the first morning void. So make sure make sure you're reading those answers to make sure you pick the correct one, okay? Easy points that could have been missing. All right, let's go to the next one. Okay, which of the following would be recorded under the objective section of SOAP notes? If you were with me from the beginning, we went over SOAP notes. We know O is objective. So now tell me which one is the objective note. We know subjective is the patient. Objective is now which one? Remember, objective is what you observe. Your observation. This also means your vital signs. That was a big thing I hinted, your vital signs. All right, so what did you observe? You observed they have a fever. How did you observe that? You took their vital signs. You took their temperature. So that's how you know. Patient reports, that's subjective. Patient's concerned, that's subjective. Patient prescription for antibiotics, that's the plan. So C is the only objective note here in SOAP. Okay, all right, you guys are doing great. Let's go to the next one. The angle of insertion for an intradermal injection is, yes, go over your injections. The 3 types MAs can do, IM, ID, sub-Q. What are their angles of insertion? What part of the body do they go to? That's good to know. What are the gauges, right? Like, what does 18 mean versus 23? What is the syringe and the barrel? Get familiar with those things because they like to ask about that on the exams. So, real quick review here. IM is intramuscular. This is the deepest because it's going into the muscle. That's 90. Sub-Q, that's going to be the adipose tissue, the fat. Okay, that's going to be at 45, oops, sorry guys, at 45 degrees. Intradermal, that's like the skin, right? Like right there, intradermal, within the skin. This is going to be at a nice 10 to 15 angle. Intradermal, this is your tuberculosis skin test or your allergy testing. Okay, if the question said angle of insertion for a TB skin test, you would need to know TB is ID, ID is 10 to 15. Okay, so it might say ID injection, it might say tuberculosis or allergy testing. So no, these are the tests we're going to do for ID. Okay, 25, that's more venipuncture. They usually put like 25, 35 angle. And then we already know these. All right. All right, I see some comments here. Yep, that's right. Sub-Q 45, IM is 90. That's right. And it's because where you're going to be injecting dictates the angle. You want to go deep, you want that needle to be straight on. If you're going, more superficial, that angle's going to change because you don't need to go as deep. All right, good job, guys. Let's go to the next question. Which of the following is a spirometry test used? Which of the following is a spirometry test used to measure? So what is spirometry? All right, spiro means to breathe. This is why it's so important to know medical terminology because it's going to save you. Spiro means to breathe. Metry usually means to measure something. So this is part of your pulmonary function test. You guys may know this as PFT. Okay. If you picked blood oxygen saturation, this is your SpO2, aka pulse oximeter. Pulse oximeter and spirometry are 2 different things, okay? Blood oxygen, you're measuring a blood gas, that is pulse oximeter. You're measuring the ability of someone to breathe, that is pulmonary function test. spirometry. And then heart rhythm, you guys know that's BMP, right? Your pulse. And nerve conduction, I think that's EET. But nothing to do with the breathing. All right, I see a question here. I knew it. Yes, medical term is very important, so definitely review and get comfortable with it. It should be like learning a new language, the language of medicine. Awesome. Okay. All right, we still have a couple more questions, so let's go to the next one. And then again, it's gonna be open floor there. So if you have anything you want to go over, we'll be able to do that. Okay. A medical assistant witnesses a coworker taking office supplies for personal use. The most appropriate first action is to. Now, notice how it says first action. Don't skip these words. What is the best action? What is the first action? What is most appropriate? What not to do? Except you want to be able to really make sure you're reading these word parts so you pick the correct answer. Okay? Now, this is an ethical question. You know, we got conflict here, of course, ethical conflict. But the first action to do is to report. We want to report the incident to the manager because it is stealing, you know, using office supplies. All right. And again, when you have these questions, think about what is really the best thing to do ethically. Because in the real world, you might do something else or you might have a different protocol, right? Some offices maybe have a protocol for certain incidences. Follow that. But when it comes to national certification questions, we're looking at, you know, best ethically what you should do. So that's going to be that. I know confrontation sucks. Reporting that sometimes sucks, but you got to do what you got to do. All right, the universal standard speed for recording an EKG. Remember, they love EKG questions, so be familiar with the machine, the placements, the artifacts, the conduction system, all of that. I'll say C, but naturally D. Yep, I get that. So always make sure the most ethical question. And if you get an administrative question, it's going to be the most business model question. What's best for business is how I like to think about those questions. All right, the speed for an EKG standard is your 25 mm per second. There's no way to solve this question. You just have to know that for a fact. Okay, so it's 25 mm per second is standard. If it's talking about height or peak, that's 10. Okay, so on like an EKG, like how tall the wave should be, that's 10. Okay, but for speed, how fast the machine is going, that should be 25 mm per second. Again, just a fact you should know. I have seen this question on many national certification exams, especially in recent years, and I just go over it with my students so they know. It's an easy question you don't want to miss. All right, let's go to the next one. We still have a few more, just one or two more, I think, and then we'll have open discussion. So if you have a question about anything, we'll talk about it. All right, which of these is a contraindication for taking a patient's blood pressure on a specific arm? Contraindication, if you don't know what that means, contra means against. So pretty much a reason, an indication why you shouldn't take that blood pressure on a certain arm. And if you didn't know there were reasons, this is a good time to review it. There are conditions or situations in which you don't want to use the left or right arm to measure blood pressure. The most obvious ones are pain, fracture, recent surgery. All right, someone just had pain, fracture, recent surgery on that arm. You're obviously not going to use that arm. Just like taking a temperature. If someone has mouth sores, recent dental surgery, you're not going to do an oral temperature, right? So that. But other indications, a very common one that you should know is this one right here. Mastectomy, either partial or complete, means removal of breast tissue. Part of breast tissue removal due to cancer or any other reason or diagnosis also includes the removal of lymph nodes and their surrounding structures. So when you remove lymph nodes, lymph vessels, it actually affects the blood pressure. And you may be thinking, well, blood pressure's in the arteries, not the lymphs. What are you talking about? We now know that the lymph system runs parallel to the cardiovascular system, and it helps to remove excess water and fat and other nutrients that are extra in the blood vessels. So if you have this system that's affecting actual contents in the blood, yes, it's going to start to affect your blood pressure. So therefore, if someone had breast tissue removal on the left side of, their left breast, we want to avoid that left arm. We want to go to the right because we know lymph is affecting blood pressure. Intravenous line on the opposite arm. Well, if you're already going opposite of it, then that doesn't make sense. The patient is right-handed. Not really a reason to not take it on the right hand. The patient has a small bruise on their hand. Again, that's a hematoma. It could be old. Doesn't really have anything to do with circulation. If they were actively bleeding, that would be a contraindication, okay? No, you shouldn't be performing blood pressure on an arm that's actively bleeding. So mastectomy here is the one that makes the most sense. All right, I saw a question pop up. Where can I access these questions to study? I have my test on Friday and you want to study them. Well, good luck. Best of luck to you on your test. So I'll have this posted on my website. That's mastudysource.com. I'll have the video. Don't worry, it'll only show my screen. It won't show anyone in the chat or anything like that, so you'll be able to do it. I have tons of questions and free resources on my website. I can show you that once we go over the next 2 questions. I can show you guys my website where to get free questions, practice questions, and other resources to help you study. Okay? And we have a nursing student there. Hey, how's it going? Medicine, if you're in the medical field, you're always going to be a student forever because you're always staying up to date in your scope. So everyone's welcome, not just MA, but everyone in the healthcare field, or if you're just curious. All right, so I hope this question made sense. I'm going to go to the next one, and then we'll go over, I'll show you guys my website real quick before we do the open questions, so if you want to go over a topic. All right, what is the medical term for surgical removal of the gallbladder? So we did medical term earlier when we looked at nephrolithiasis. Now we're trying to come up with the medical term of the definition we have here. I'll give you guys a second. RMA exam on Thursday. Best of luck. I wish you the best of luck. Keep practicing. You got this. And let me know what you get. You graduated in 2017. You'd rather do CNA work? Yeah, that's fair. I love education. And I've been an MA since 2015. Yeah. So, experience, once you get experience out there, you see what you really like, what specialty you like, what kind of work you like to do. Yeah, it's very important before you get into a field, you really do research and kind of explore and see, because you always want to invest your time and money in something you're going to enjoy doing, Yeah, graduated in 11/20. Well, congratulations! All right, I'm seeing a lot of answers there. Good job. So surgical removal, you should already be thinking ectomy, which all of them have, so not very helpful, right? And then gallbladder, which can be divided into 2. So bladder is cyst, and then gall is chole. So together, you guys had it in the chat, I saw it. It's cholecystectomy. All right, if you see cyst and the answer is gallbladder somewhere, make sure it's not talking about the urinary bladder because cyst just means bladder. Unless there's chole, it could be talking about the urinary bladder. If it says cholecyst, that's the gallbladder. So make sure you review your med term. All right, and I think we're at our last question. Yep, that looks like my last question there. An angry patient calls to complain about a bill. The medical assistant's best course of action is to, and remember, business model when it comes to these kinds of questions, what's the best thing for you to do? Maybe your office has a different policy, but it's not asking what is your office doing. It's asking about what is the best course of action. So always think in a business model, okay? Because my students, when it comes to these questions or some questions about protocol, they get confused because they're like, my office doesn't do this. Well, it didn't ask about your office. It asked about general business model. Okay. So, of course, someone's angry, you acknowledge it, and of course, in every situation, you want to stay calm. That's the best thing for you to do. Transfer the physician doesn't really do anything. Argue with the patient, well, that's not good. Tell the patient there's nothing you can do. Sometimes you wish you could do that, but you can't. The best thing to do is to listen calmly. Okay?